Today's tip is all about substance use disorder versus dependence, which triggers HCC 54, 55, and 56. There are 11 substances that can lead to a substance use disorder, or substance dependence diagnosis. Some of these substances include alcohol, opioids, nicotine, sedatives, hypnotics, anxiolytics, stimulants, cannabis, and other illicit street drugs. It's important to note that substance abuse or dependence, although still in use in ICD-10 coding, is no longer used in proper documentation of a behavior-related issue per the DSM-5. A coder can code abuse or dependence, but the number of support statements or criteria will change. For example, if you document substance dependence instead of substance use disorder, mild, you will need to document 4 out of the 11 criteria statements to support that diagnosis, instead of the 2 that are required to support substance use disorder, mild. There are a few questions you should ask yourself about your patient. The answers to these questions, along with the observation of your patient's behavior, will give you an indication of whether or not the patient is suffering from a substance use disorder. Remember, this is not about a physiological addiction to a substance. It is about the behaviors that your patients exhibit regarding the substance. Does your patient get upset when you suggest cutting back on the medication? Or, if the patient agrees to try, does the patient return within a week to try and get back on the original dose? Does the patient express the inability to live without the medication? Another big indication is if a patient is taking a medication longer than he or she should. For example, benzodiazepines should only be used short term. If the patient is taking Xanax 3 times a day for many months, there is a problem, according to the Beers criteria. Your patient might have a substance abuse disorder if he or she takes a substance longer than prescribed, reacts poorly to the idea of cutting down, comes back to the office after reducing medication, and requests more. Some patients will even go as far as calling the insurance company to complain about not getting the medication they requested. Or they'll go to multiple doctors to seek more of the same medication. Hoarding medication. Other signs of substance use disorder include taking the substance to avoid withdrawal symptoms, frequently falling or having accidents, using even after causing self-harm, having constant financial or social issues, and self-medicating to help other issues such as anxiety, depression, or insomnia. Remember, billing will not send in an unsupported code, so save time and document correctly. If your patient only meets 2 to 3 criteria, you would code it as substance use disorder mild. If 4 to 5 criteria are met, you would then code as substance use disorder moderate. As always, say what you see. Thanks for watching. I'm Dr. Tharp, and this has been your MRA Tip of the Day.